Do you want to learn how to increase your language around intimacy? Maybe how to explore different things with your partner, or even if you're having pain with intercourse or sexual dysfunction, how you can start to access and change your intimacy and sexual health today? Well, look no further, because I interview Sadé and she covers all of this and so much more. Hi, my name is Laura, and on this channel, I help you gain optimal health through knowledge and movement. Okay. What in the world? Instagram, get it together.
This happened to me like a couple days ago too, so I get it.
I was like tired, and I'm like, no. Okay, don't worry. I'll do a little recap of what we said when we post this on lovely YouTube. So as a cap, for people who watch this on the feedback, Sadé shared with us that she is that she reverse engineered her way to get her master's to become a licensed marriage and family counselor solely for the purpose of being someone who can work with women around shame and sexual dysfunction as a sex therapist. And she shared a very amazing story about what brought her to this, which was women who were being sex trafficked. And that's kind of what sparked that kind of searching and path to getting to helping women now. And before Instagram cut us off, I was saying that my parents must have thought I was a very odd duck as a child, because I was doing, and I think it was in like 7th or 8th grade, I was doing a report on female genital mutilation. And I remember my mom typing it up and I went to a Catholic school, and my mom being like, "You're going to get kicked out for this. You have to find some different topic." And I was like, "This is the topic. This is the topic, Mom." And she let me do it and didn't say boo about it, and typed it up for me because I was horrible at typing. And yeah, so I love hearing those stories. So very, very cool.
I think I was actually into like mature topics like that too at my age, except for me, I liked watching live births.
Oh my God, yes.
You know what, a baby story?
Yes. When you were saying that, I was like sitting there and I was like, I know what it is. TLC, a baby story, or like I didn't know I was pregnant was another TLC one. I watched that on repeat. Again, my parents didn't say anything. They just like let me go with it.
Yeah,
I don't know what they were thinking. I'm sure they were like, what is our child into? I don't know. So yes, that is so, so, so awesome. So now, so how long have you been practicing? And I'm sure so you're in Atlanta, right?
Yeah.
I'm sure that is like, oh my gosh, I can't imagine. So I'm in a small town of like 85,000. Like it's growing. I mean, Mayo Clinic is there, but like it's not like a city, like okay, I'm gonna be in Minneapolis or something like that. So I'm sure it's just crazy. So tell me, where are you practicing, and share a little bit with people, because I know before you were telling me that you have kind of two different sides to you, which I love.
I do, yeah. So I am it's funny because we talk in Atlanta about like how when we're talking to someone outside of Georgia, you just kind of say Atlanta. That's the easiest way for people to get where I'm at. Yes. So I'm in Sewanee, so it's kind of like a little bit on the suburb side, and I work as an associate therapist at Building Intimate Marriages, which is a practice that for the most part, we really do focus on, like the phrase is kind of getting to the heart of relationships. So we do a lot of affair work and a lot of sex therapy. Nice. And I intentionally chose to come to Georgia and to the Atlanta area because, I mean, you're in a small town, so you kind of know. It's like, I just wanted to experience the most of it that I possibly could. which I have been able to. So that's the therapy side of me where I deal with dysfunctions, affairs, because of course affairs are going to impact sexual functioning as well. And I really, really, really love working with kind of a woman who has never been very comfortable with her sexuality. And then she has this partner who is just so patient and so willing to do whatever it takes for her to be comfortable and her to enjoy intimacy. And then on the coaching side, I like working with women who are dating actually and trying to figure out their sexual selves in the single part of their life. And for couples who have already done that kind of deep work, just gets them to a place where they're more goal-oriented, like, okay, we just want to figure out how to diversify our language communicating around it. So, yeah.
That's so awesome. So can you kind of share with us how might someone diversify their language around like communicating like that? Or because I honestly, so when I work with people, a lot of times I'm all about my boyfriend jokes, I'm all about the angles, like what angle do we need to get here to stimulate the nerves for this? Like I'm very much, I feel like a mechanic, is there enough oil? Is there like that, that's kind of like, it's literally like an engine to me, and so it's very interesting for me to talk to a therapist. I love working with therapists because I honestly, when you were saying that, I was like, what is doing the language? Like, because I'll say like, how can we expand your sexual menu? Which again is a very nuts and bolts angles, which is not the language piece. So can you kind of enlighten me on that?
Of course. So first of all, our language that was given to us just through culture and through media and even through our parents is very limited around sexuality, because either you don't talk about that, it's not ladylike, or it can be just on the crass side. So we're using the language of, overall very male-dominated language given in terms of female sexuality, which doesn't quite make sense. So with couples, we start out and I'm helping them, first of all, know their anatomical language. So if I say a word like vulva, how does that make you feel? And you know what that is. And just really just working with the building blocks there, and it's okay. I love when they're like, this feels weird, I don't know. That's fine, because we're learning now.
Right.
And then like the next layer of language is changing from a linear model of seeing intimacy, where it's like we start with, he kisses me and I know when he kisses me this night is going to end in sex, and so I'm just going to shut all of it down, all affection, all intimacy, because when we're talking about pain, like it hurts,
right? So
how do you stop the hurt? I'm going to stop it when you are feeling a little bit too warm and fuzzy for my comfort.
Yes.
I like giving language around diversifying your intimacy palette. Like, let's not see it as a light switch, but instead see it as this just wide array of different times of play, or maybe sassy intimacy, serious intimacy, that you can specifically ask for the type of connection you're looking for, instead of feeling that you have to shut down your entire sexual self just because you don't want it to end a certain way.
Right. I love that. That is so cool. And I think it's so, you just hit the nail on the head, because it's like, first of all, what you were saying about the language, it bugs me when I go online to find information. And this is why I love working with sex therapists, counselors, all of that, because you guys give me so much more language than what you can find out there, because it's always like over sexualized. Like when I look to say, find out how do I even use this vibrator? Like how do the buttons work? It's like very sexualized, and it sometimes really irks me because it's like, no, I just like, I literally need a better manual than what they sent me. Like, I don't know why you're like talking in this whispery voice. Like, I just want you to like literally just, you know, or I don't know, that's just, I was watching something the other day, and they were like, hey, you curious fuckers. And they like went into it, and I was like, wah! I know. I was just like immediately I was like, wah! You know, and I'm like, why does it have to be so always like in your face when it can be so many, there's so many other ways, but I don't think people really show those other ways, you know? And so I love that. And that's one of the reasons why I first like grabbed onto one of your posts, because it was the popcorn intimacy.
Yes.
Which was so great. So can you share with people what is popcorn intimacy?
Yeah, okay. So I think I remember this one. Popcorn intimacy was the one where I was talking about those kind of like 15-minute or 15-second check-ins, right?
Yes.
Yeah. So it's this idea of expanding intimacy beyond the moment of just sexual energy. So you can have this intimate connection and affection with your partner, and you should daily if you can, where it can be just eye contact, uninterrupted, not the kind where you're like, yeah, hold on, just, you know, or it can be like, how are you doing? Like, really, not in your role necessarily as a parent or even in your role as a boss, but just you as a person. And so I love helping people rewind and say, when we're on the quest for better intimacy, it really doesn't even start with sex at all. It starts with things as simple as, do you know what your partner's hands feel like? Have you memorized them so well that you could be able to tell if they got a new scar or something like that? Slow it all down. And so it's ironic because it's popcorn, but it's also this slowing down of the experience.
Yes. Yeah, I totally love that. And I think, again, whether you're listening to this as a person who is wanting more information about how to kind of find intimacy with your partner, learn about pelvic pain, whatever brought you to this live, or you're a provider, what I have found really helpful in listening to information you've been sharing on your Instagram account with other sex therapists that I've networked with is it allows me to ask a patient some of these questions, to be like, when you're with your partner, what does that look like? And so for what I see on the flip side, and when I know I need help from a colleague like you, is when you were talking about that linear kind of sexual pattern, or very goal oriented, like, okay, we kiss, then this happens, then this happens, then we have sex. And then, you know, because a lot of times I'll see women and they're like, I'm just not, like, I don't have a ton of libido. And I'll be like, well, is sex exciting? And they're like, well, it's very, like, it's every morning on Saturday. Like, I get up, I have to shower, he has to shower, we brush our teeth, we get into bed, and then we do the thing. And then, you know, it's off to our morning chores. And, you know, and so it gives me, again, some more language and some more context to be able to capture things where it's like, okay, it's not a nuts and bolts kind of issue. It's also that mental component, which I really think any sexual dysfunction is, I would say some people who come to, or I would say probably almost all people that come to me with a pelvic floor issue that's sexual dysfunction related, they would benefit from a sex therapist.
Absolutely. Yeah. It changes how you feel about your body. It changes how you interact with your partner. And then, of course, as therapists, we're kind of systemic. So we see this larger web of how things are connected. And so it really does take therapy for you to see this issue that we're having with sex is also somehow playing out in finances and how we talk to our in-laws. And
interesting.
So, yes.
Can you explain more to me about that? Because I'm like, I'm fascinated. I'm hooked. Like, tell me what that might look like.
So we have this term called isomorphism, which is basically, it's a copy paste button. It's saying that when you have a certain dynamic playing out in your relationship, it is likely copied and pasted into some other area of your life. So a non-sexual example would be, you go to work and let's say you have a boss and you get into it with your boss. Then you get home and your partner says, hey, can you take out the trash? And you immediately are activated. Like you push back, but it has nothing to do with your partner. It's just kind of this similar dynamic playing out here.
Yeah.
So with intimacy and sex, it'll be something like, okay, so in our regular lives, he's always telling me what to do. And I just kind of like, I'm silent and I don't respond. Once we get to sex, they might say something like, well, he initiates and he's kind of moving my body around and I just want it to be over. So I don't really say anything and I don't really tell him if it hurts. I don't make any noise. Just want it to be over.
Yeah.
Sounds familiar to me. Sounds really familiar. And so the awesome thing about it, I love therapy so much. The awesome thing is when we can start to heal it sexually. Let's have an experience where you initiate or where you can say something as simple as, I liked this, or could you change that? I didn't like it so much. Then you hear the couple come back and I might ask, oh, by the way, how's communication? They're like, oh, it's been getting a little bit better. Yeah, it has.
Yes.
And we get to like celebrate that.
Yes.
So everything's connected.
That is really, 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 really cool. I try to tell patients when they're working with me, I'm like, some of the stuff that I'm asking you to do goes into all aspects of your life. And they never believe me. I'm like, trust me, believe me. And they're like, okay, sure, Laura. And then usually by the end of it, they're like, I had to change a lot of aspects of my life. And I'm like, yeah. I'm like,
that's wild that you came up with that by yourself.
I know, exactly. I'm like, oh, you're so great. Yeah. So I have to laugh. So it makes me feel better that I know that I have a comrade in this who also experiences that, except you have like an actual thing that it's called. I'm always it's just going to happen.
I think it's something that it really is a really wild concept. Like, what does me taking out the trash have anything to do with not having an orgasm? So when that's the beauty of therapy, because you're in this relationship with your therapist where they can say, okay, you might not remember this because you're in it and you're living it, but I remember 4 months ago when I asked you the same question, this is how you responded, or this is how your body felt, or it caused this kind of tension. Do you see how easy that was for you now? You worked 4 months for that. But that's hard to do on your own. So of course they don't believe us if we don't.
Right. Of course. So now, how do you find that people come to you because they have pain with intercourse, or they're already working with you and pain with intercourse comes out?
Yeah, I think that's the unique part of our practice because we kind of are, focused on affair recovery and sex therapy. Usually people coming in, they might not tell us on the phone, they might say communication issues. But when we're like sitting in the room together, it's like, okay, here's what's happening during sex. And I will always ask because I understand that that's part of the system. If you don't have comfortable talking about intimacy with your partner, why would you tell a stranger about it? But the pain part, usually my ladies with pain are so awesome because they are at this point where whether they've been having pain for a month or for 10 years, they're like, I'm done with this. I will do whatever it takes. And it's almost me having to say like, yes, I love the enthusiasm. Slow down.
Right.
That's kind of contributing to the problem.
Yes.
But they're so ready to learn about their bodies, to learn the language. And it's really fun. I even have some ladies who are never consummated. So it's really cool to get to that point where you're like, guess what? I had sex. And we're like, yeah!
I know.
Congratulations.
Isn't that the best day? Like, there's no better day than that day. Like, for a work day for me. I mean, there was, of course, a lot of wins, but like when I will have a patient come in and they're like smiling at me, and you're like looking at each other and you're like, and they're like, guess what? Guess what? I had sex. And I'm like, yay! I feel like I'm like in college or something like that. It's so great.
Yeah,
So what are some of the things that and I know you covered some stuff on the takeover, but like when you're working with these women, like you said, sometimes they're gung-ho-ness. You're like, hey, let's peel it back. Let's take a pause. What are some things that do you work with them just to kind of give listeners kind of an idea? Because I think, like you said, you work in a unique practice where people maybe know they have pain going in. I know for me, a lot of times I have to convince people we need to get you to a sex therapist. And they're like, no, I don't need a therapist. And I'm like, we need a therapist. Like, we need a therapist. And so, so what do they have to bring in their partner? Do they meet with you individually? Like, what for someone who has pain might therapy look like? And I know it's kind of different for everyone, but generally.
Yeah, it is. It's case by case, but basically what we do is sometimes they'll come in by themselves and they may not feel that their partner is 100% safe yet for them to explore some of the stuff, or they just don't, they feel pretty good about the relationship, but they say, I know a lot of this is me. And so we get some individual time to process at her pace and have her explore stuff from her past that may have had nothing to do with him or her. But I do encourage at some point, if they come in, individually, let me know when you're ready to bring your partner in, because we are going to be, this is talk therapy, so they'll do it at home. So we're going to be doing some exercises where your partner's going to need to be in on the conversation of how hard this is for you. Your partner's going to need to understand this has nothing to do with you. And I'm using heteronormative language because a lot of the time penetration is with a male partner. This has nothing to do with you. It's not about you not being able to please her. It's not about she's just not attracted to you. This is so much deeper. So can we get together and see that the pain is not her problem and her body's problem, but something happening within the relationship that we're going to give time and space and patience to. And then I also say, this is the part where she breathes a sigh of relief and he kind of holds his breath. Say, can we take sex off the table just for a little while until we can eagerly and willingly say yes to sex? And then that's a fun conversation to explain.
Yes. I document that as penetrative sex embargo. That's how I'm always like, placed patient on penetrative sex embargo. And usually the partner is usually the person that's seeing me is like, oh, thank God. And then the partner is like, wait, what?
Yeah, so I don't think this is going to solve our problem. And then I get to explain, okay, now let's go back to and this is a whole session. Define sex for me. Tell me what you consider satisfactory sex. Tell me what kind of activities you consider part of sex, to which there's always this this might be TMI, but I'm like, that's okay. TMI.
Yeah. I know. I love it. People always are like, I'm really nervous to tell you this. And I'm like, because I've been doing this for coming up on 10 years. And I'm like, I don't know that there's been too many things that I haven't heard at this point. I know there's been things I haven't heard, but really, I don't think you're going to shock me. I did have
Yeah.
one person who shocked me. The person had just had a baby and truly did not know that they had a urethra, a vagina, and a rectum. And when they were sitting there and I was showing, we were going through the anatomy and I was saying, we need to take an embargo because this is where you're having pain. And she was like, is this my vulva? And I'm like, yes. And she's like, what is that third hole? And she like looked at her partner and he's like, oh my God, it's your urethra. And he was like, we do need to take a pause if you don't know that. And I was like,
I love those conversations though, because when there's so much shame around sexuality and you never get to ask those questions, and there comes a point in age where it's like, I think everyone else knows this, so I guess I'm just not. And it's really cool in the therapeutic relationship to have the Q&A session of like, okay, let's go.
Yes.
What are your beliefs? Let's see which one of those are myths. Ooh, speaking of big myth, ladies, high desire, low desire. Okay, those are comparative terms in the sense that it's only a problem if you have a problem with your desire. So I call them comparative terms because if your partner wants sex 7 times a week and you want sex 5 times a week, you don't have low desire.
Right.
It's lower than your partner's, but it's not. And I think that a lot of the times couples get really stuck there. Like, we don't want sex the same amount of times. And so there's a problem. It's like, okay, we can get you to a similar vibe, but let's strip away the stigma of like, this partner's right and your desire's wrong.
Yes. So I have a question because I feel like this COVID time has been really weird. And one of the things that I've noticed for my people who are not partnered is they're coming to me reporting concerns because they feel they have low desire because their desire did not match either pre-COVID time or some people, they'll compare themselves to when they were younger or something, or like pre-menopause or something like that. So I'm just wondering when you were saying comparative, my friend always tells me comparison is the thief of joy. So yeah, what are your thoughts around when you're comparing yourself and you're using yourself as the benchmark?
Oh, that one happens so much. And I have this audio course on my page where I kind of go deeper into that, but it's this idea of seeing that you just ebb and flow throughout your life. And that's the part that culture is really, really, really bad at teaching us, because there's only one type of sexuality. It's kind of where you get home, you pull your clothes off, you throw yourself against a door, and it's things break, and that's like, oh, that was great, good job. But what happens if you have a baby, your hormones are off? What happens if you're in a depressed episode? If you're in an anxiety-inducing episode, like olive pandemic? What happens if your life is really stressful for a bit, or you haven't been taking the right vitamins? And so there's so many things. And so the comparison thing, I just try to focus people not on like, don't compare, but instead listen to your body. What's your body asking for? If you want intimate connection, how would your body like that now? Okay. Your body doesn't necessarily want penetrative sex, even though it did 3 months ago or when you were 16. Okay. So instead, would your body like to cuddle naked? Would you like to do absolutely none of that and just eat some cheesecake with your partner? That's okay. We prioritize holistic intimacy over a specific model.
Right. I love that. Holistic intimacy. That's such a beautiful phrase, and also kind of a plug for an offering that you have. So can people access that through your Instagram or through your website?
Yeah, both. So if you join follow my website or Instagram, My Intimacy Therapist, for both of them. It's Communication 101 for sexual intimacy. So this is not therapy. It's not a substitute for therapy. Find a sex therapist in your state, but it is designed to give you the language to talk around what is happening in your body, for your body, with your body, and your partner, which I think is the building blocks of all of it. So much dysfunction is held in place simply because we don't know how to talk about what's happening for us.
Right. Totally. Yeah. Everyone always says, they always are like, oh my gosh, they tell me I say so much, and oh, Laura always talks about these things, but to me it's normal. And I'm like, why does it have to be weird? Like, we can talk about it and it doesn't have to be like creepy. So I love that you're kind of, so the thing that I love a few things about it. One thing I like, and what I'm really passionate about on my platform is improving access. And so that's one of the things too that I really loved when I started following you and watching you. And I think is so huge right now is I feel like, so I have this doctorate degree, you have your master's degree, and I always get so frustrated because here I have all this knowledge in my brain and I just want to like give it to everyone so they can have the language to appropriately communicate. And so it's like, how can I get that to people? Because it's an access issue. I shouldn't have to, or regular people shouldn't have to go get their doctorate or go get their master's to be able to access good care. So I love that you're narrowing that gap, but then also that you're really kind of exploding some of this taboo, shame-based ideas, which is really, really cool.
Yeah, for me, the access thing goes hand in hand with culture too, and privilege and all of that. And honestly, that is a whole nother, well of information. But sex therapy is an investment.
Yes.
Pelvic floor therapy and sex therapy together is an investment. It's incredibly helpful.
Yes.
And an investment. And so that's why I wanted to have this audio course where it's, even just my Instagram itself, where you can start kind of having your gears turning.
Yes.
Start thinking about those things, even if you're not currently able to access therapy, or there's not a qualified therapist for this in their area, because
that's huge. That is so huge.
It's
Don't
a
even
thing.
get me started on that.
I can't even tell you
how many people probably are going to start messaging you. They message me and they're like, can you see? And I'm like, I'm not licensed in your state. I want to help you. I'm constantly messaging my lawyers. I'm like, can I please help this person? And the lawyers are like, no, you're not in your state. And they're like, you certainly can, but then you're going to be, then if someone reports you, it's a gross misdemeanor. And I'm like, So yes.
We can help you, kind of know what to look for in a pelvic floor therapist or a sex therapist. Because, and I think this is another thing too, with pain and anxiety issues, you're almost always used to being in the down position. You're never in the position of power. You have doctors prodding and poking. I have heard horror stories from my ladies about what doctors have told them, how they've treated them. But you feel like, oh, that's the expert. I just kind of have to take it. No, ma'am. They work for you. We work for you. And so I kind of empower them, even in our first session, like, if we're not a good fit, okay, I'm really proud of you for knowing that. Can I help you find someone better for you? Or, let's collaborate and try to make this process what you need it to be. So if you're looking for a sex therapist or a pelvic floor therapist, let yourself be the interviewer. Let yourself find out if that person is who you want to help you on your journey, because it's a sensitive.
Yeah, I love that. Now, I do have another question for you. Do you find, so again, caveat, I am in Minnesota, and I am in the southern part of Minnesota in a small-ish town that is surrounded by farm. communities. So it's predominantly white. Do you find that there is, because I know when I was in Atlanta, it was like so beautiful to see, like there's so much culture. I loved it. I really love Atlanta. I got to spend a week out there while my boyfriend was in a continuing education course, and it's one of my favorite places to visit. And so do you find that working with different cultures, that there are different, or people of different skin tones, different backgrounds, do you find that you have to change your therapy, or do you find, or even when you were going through your master's program, does the research show that, okay, among African Americans, there's a difference here, or even Asians, or, you know, because I know for me, for physical therapy, a big thing that's come out is, for African Americans, there's a huge issue with birth. And there's a huge mortality rate that's really, really, really upsetting. And so I was just wondering, with pain and some of the sexual dysfunction, is there more, less? Do you have to change your therapy or anything like that?
That's a great question. I'll start by this. Research is very white.
Yeah.
Very, very white. And unfortunately, you look, I was going through my grad degree and then my sex therapy certificate, and each time I would try to write a paper that was culturally diverse and about pain. And it was like each sample size was 96% white people and then 1% African American. We don't really know what the rest of them were. It's like, okay.
Oh God.
Hello. What? So I don't think research in itself or academia knows that much about how different ways it shows up for different cultural groups, but the language is different, the comfort level is different. Mm-hmm. And so with me being in the South and the Bible Belt, I think for anyone who's got that religious lens, there's obviously, and that's kind of what I created it for, is for anyone who's uncomfortable around the language.
Yeah.
But then when you get into different cultures, the expectations are different. What I mean by that is, we can't say this is the healthy version of sexuality that everyone should fit into, or they're unhealthy. Mm-hmm. It's more of saying, all right, how do patterns and generational influences and all of that show up within this culture? Yeah. So if someone tells me, I really can't think of anything off the top of my head, but maybe something like they had their first kid when they were like 18, and then they're things like that play into the story. And what surprised me about research is that a lot of the time it says, if you're not doing it the right way, then you're not doing it the right way.
Right.
Oh no, that's not it. So, which obviously I have white clients too, but I just try to be cautious.
But that makes so much sense. Like, I mean, even if you just think like, even if you think, like you were saying, like a lot of our, how we get our knowledge around sexuality and what's okay and not okay and all of that, like a lot of that is shaped from our parents and our family. So I think of my sister happens to work a lot with the Laotian community, and they have like everyone almost in one house. So it's like many, they can have like 4 generations in one house. So when you were saying that, it's like it just kind of sparked in my mind. I guess I never really thought of that as a way of shaping how then a patient might come into me, because again, like a lot of the people I see are white people. So they're, you know, they have been raised very similar-ish to me, in that, like, I mean, I guess this is a generalization, but many of my friends and many in the community were like very separate. Like, you know, my grandparents lived over there. We had our house here. Like we saw people on like maybe for a family dinner, then we went back to our separate communities, versus some of these other cultures that might have multiple generations in a house, or grandparents that are raising kids because parents are out working or whatever. And so that's really just interesting to me, because Yeah, I think that can change a lot of things.
Absolutely. Especially when you're like, all right, go home and do this exercise. All right,
Yeah.
well, is your mom visit home this weekend? Or like,
Yes,
you don't necessarily want
totally.
to practice like a penetrative
Yes.
exercise with, mom next door.
Yeah,
But
totally. Totally.
not putting like trying to put a negative lens on it either, just seeing it
Mhm.
as part of the story.
Right, right. Yeah, research really bugs me personally. So I used to work at Mayo Clinic, and they're hugely evidence-based, and I get it. We need to have evidence for things and whatever, but at the same time, I like to work, I have a huge passion working with the transgender population. And so there's like no research out there for that demographic for the areas that I look to. And a lot of times when I read some of these books, so I can have more language, like a sex therapist, so I can pick up on things and then know when to refer. It's Many of the books start by saying this is for people who are in same-sex relationships or who are attracted to the opposite sex, because there's just no research out there to be able to write a full book on same-sex couples and whatever. And I'm like, man, like if that isn't erasure right there, and it's like 2020, and so it just is very it just kind of irks me. And so which is what you were saying, that it's just very frustrating that there's not more out there now. So
Yeah. Yeah.
yeah.
And I decided a while ago that like me researching isn't the way that I want to add to that. It's just like showing up and
Yes.
providing space for who I'm talking to. And
Yes.
that's where I think my page came about, is let's
Love it.
just create that space.
I love
Yeah.
it. So I'm really interested, and before we run out of time, about you working with people who are dating in COVID time. Like,
Yes.
oh my gosh, talk to me about this.
Yes. Okay. So that, I call my work like spiritually infused, because I think a lot of the shame stuff around sexuality, like it makes it so that they're mutually exclusive, right? You either are a spiritual person or you like sex.
Right.
Oh no. And so with dating right now, this is a whole other depth of thing, but I think in the religious community, there's this gap between, I don't know if you know much about like the purity culture movement, but there's
I know
this
I'm
gap
starting to
between,
see more of it, and I'm starting to like research it more. And definitely growing up in a Catholic school, I'm like, oh,
you got it. Yeah.
yeah,
It's like these rules and regulations are, this is how you be good or be acceptable or be pure. And then, but if you don't get married by the time you're 22, yikes, don't know what to do with you. So
yes,
good luck. Don't screw up. Have fun, but
yeah,
don't. So
yes,
I wanted to start this conversation for people who are like, but spirituality is an important part of who I am. And also, I'm like 32 years old. Are you trying to tell me that like
yes,
there's no more of the conversation for us?
yes,
I feel very strongly about it.
yes,
Yeah. So
yes.
that's something I'm hoping to do a lot more, as there are ladies that are interested in that conversation.
I think that that's really awesome, because the flip side, again, of what I see, and I know what you see, is with this purity culture, and like you shared earlier in the IG live, is people aren't able to consummate their marriage because they're like, so for so long, sex was bad, and I had to keep my legs closed, and I couldn't do this, and I couldn't do this. And now suddenly we had a big wedding, and it was super stressful to plan. We had a wedding, and now suddenly sex is okay and I'm just supposed to do it. And they're like,
All the time. Or
what
else.
the hell? Yeah. And so so I think that that's why I thought it was so cool when you were talking about it, because I'm like, man, this is so good. Because there are so many people where it's like, it's just such a internal battle and struggle, but then we don't catch it until they're married and there's, okay, now here's a big problem. But it's like, if we would have started the conversation 5 years before, 10 years before, then we would have been able.
The whole game. Like, and if you're listening to this, I just want to say you are not the only one who has had their honeymoon not go the way you thought it was going to go. That is such a common experience, I think, when there's this dichotomous horrible before and then do it all the time after. It just doesn't work like that.
Totally. And I can't tell you how many friends that I've talked to that they're like, oh my God, they're like, we had sex on our wedding night. And they're like, it was literally like I was just laying there to say that we did it. And I'm like, why did you do it then? Like, and they're like, we were exhausted, we were this, we were that. And I'm like, and they're like, well, because, it was our wedding night. And I was like, but it's okay to say, I'm tired, get a good night's rest, and have sex the next day if it feels right to you. And they're like, oh, Laura, you're so goofy. And I'm like, goofy? I'm like, why is this goofy? Why is this like crazy to say to your partner, like, hey, just not right now. So I love, and I've been really pumped to see all this stuff coming out. And do you know why the purity, like, I don't know how things like gain traction and suddenly like start showing up on my feed, but like, was there something that happened in the news and then suddenly purity culture, like
recently?
Yeah. Like what? Yeah. Was there?
No, this has been going on the whole time. What I think it is, I was just actually talking to a friend about this the other day, like purity culture, the people who grew up in it are now hitting the age where it's like, they're looking around like, hold up.
Okay.
And so it's those voices that are being heard that grew up with all the beliefs and the shame and the content and all that stuff. And not to say, and I'm not throwing the baby out with the bathwater.
Right.
Purity culture, the idea, the intent behind it, I think was good.
Yes.
The execution of it.
Right.
Oh no. And it all goes back to the inability to have language to talk around. Yes, you are going to have sexual arousal.
Yes. Mm-hmm.
Let's talk about what that is and how to steward or channel it versus, just don't, or.
Right. Shut it down. Yeah. Ignore it. Yes. Yeah. Oh my gosh. This is so cool. I can't wait to like share more of this stuff as you create it.
Yes. I'm excited too. I'm building up the dating side of it because of everything we just talked about. Like,
yes,
it's important.
I think it's important. And I think definitely, like we've said with COVID, I think a lot of people are looking inward and I think I know many of my friends are wanting to be more strategic maybe in dating. And so it's like, they don't want to, it's harder to go on dates. So they want to be able to decipher and differentiate. And they're really taking a look at their own values and then trying to find language around that. And a lot of those values have to do with sex, intimacy, all, relationship, all of that. It's a huge part. And I don't think that's an area that's supported a lot. Of course, because I'm sure me and you, I like follow all of the people. So I'm like constantly consuming the information. But when I talk to my friends, they're like, oh, I don't know any of this. And I'm like, oh, you will send. So I think that's really cool. Yeah. So I know you already shared this, but people can find you at My Intimacy Therapist and then on Instagram, but also www.myintimacytherapist.com.
Yeah.
Awesome. And you have an email newsletter?
I do. So I like to give you free things if that's okay. So where you'll find that is either you can sign up and get a free non-sexual touch guide for just feeling like safe affection with your partner. That's on my IG. Or if you wanted to join the workshop that's based on the audio course that's coming up for October, and I'm actually partnering with a doula on that to talk about how even mamas experience sexuality differently. It's going to be so great. But honestly, just come over and get some free stuff and we'll be in touch.
Awesome. Well, I'm so excited. Certainly, as things come out, share them so I can disperse them to the community. It was so amazing having you. You are for sure one of my top favorite guests. My social media person and writer were like, oh my God, Sadé is so amazing. And I was like, I know, I've been stalking her for a while now. So thank you, thank you, thank you. And also thank you for riding the wave of Instagram.
Yes, thank you for having me. Let's definitely keep having conversations like this. This is good.
Oh, yes. I loved it. Have a wonderful rest of your night.
You too. Bye.
Bye.